Good morning, everyone. Oh, that's fantastic. I love that energy. My name is Professor Ian Williamson. I have the great privilege of serving as the Dean of the Paul Merage School of Business here at the University of California, Irvine. Today, I have a ceremonial role. I get to welcome everyone and start off this fantastic proceedings. I always like to start events when they mess up and give me the mic. They can't stop me for a few minutes at least. I'd be curious, if you are an alum of University of California, Irvine, could you raise your hand? That's fantastic. I always like to welcome back our alums. Thank you for taking the time to come back. The other group I'm always interested in is, if this is your first time ever to the University of California, Irvine, could you raise your hand? Any first time? Well, welcome. Thank you very much for coming. We really appreciate having you here. We'll do all that we can and be as hospitable as possible. And if you didn't raise your hand, welcome as well. We like you as well. This is a fantastic event, the 35th Annual Healthcare Forecast Conference. Our business school, I guess somewhat unique in that we have a Center for Healthcare in our business school. It speaks to how important this sector is to our region and also how important we believe this sector is to our society, and that we hope and we believe that some of the things that we're doing in the business school can contribute to the success of this sector. And one of the things that we have prided ourselves on being, in general, but specifically in this space, is that we want to be a place that curates conversations that allow leaders to be prepared for the opportunities and challenges that they're facing today, but also that they're facing tomorrow. And it really is fascinating that we've been able to do this event for 35 years. The university itself is only 60 years old. And so it kind of just speaks to how central this has been in the history of our business school. And I thought to myself, wow, 1990, what were they talking about in 1990? And so, this is the beauty of ChatGPT. I went back and said, so what were the key health issues in 1990? And so, rising costs was a big issue. The AIDS epidemic was a big issue. Access to care, transitioning to managed care, infrastructure, personnel. So I looked at a few different articles, and it was interesting to see how those themes were prevalent. And obviously, many of them are still equally relevant today. But we can also add in there demographic changes, public policy shifts, new technologies, economic uncertainty, financial constraints. So we've added to the list, I guess, over the years. But I do hope that if you look at our set of speakers today, we've done a phenomenal job of bringing together perspectives from across the country and even outside of the United States to come share with us their viewpoints on what they're seeing, offer their guidance on what are some of the ways forward. So I think we're well prepared to take on the challenges today with the audience, with the group of individuals that we have. So I just would ask that you listen, that we open ourselves up to the various different perspectives, that we learn. And learning is an interesting thing. We have to make space for learning. And it's not setting aside everything we know, but it's finding ways to add on to what we already know. And then most importantly, that you fellowship. Yes, there's going to be a lot of dialogue that's going to come at you, but my hunch is that events like this are most valuable because of the interactions that happen in between the sessions. Please, please, please meet someone that you don't know. Do not walk away from this event having only reconnected with friends. Make new friends, because we think that is key to the innovations that will spark all the wonderful ideas that we will need for this sector to continue to grow and to prosper. So with that, we welcome you. And now I'd like to welcome Dr. Hope Scal, who is the Gilley Chair in our business school, and she is also the director of our center here. Dr. Scal comes to us from University of Arizona. Previously, before that, she was at Temple University. But most importantly, and I didn't even notice if you raised your hand, she's an alum of our business school where she received her PhD. So it's always great when you can bring them back. So Dr. Scal, if you could please come up.
Thank you, Dean Williamson. Good morning, everyone. This is the 35th annual conference, and I, like the Dean, I'm pretty excited that we've had 35 pretty great years. The center has a lot of activities, and one of them, the signature event, is convening everybody here today. Our conversation today should be about what's changing, what's at stake, and what it will take to improve access, performance, and outcomes. I want to start with some gratitude. Thank you to the organizations supporting this conference, those that you see that will be rotating on our slides. You can also look in the website and the app to find out more information about our sponsors. I want to give a special thank you to California Healthcare Foundation and UCI Health for their enduring support. I want to thank people who made this real today, which is Christoph Stremensky, sorry, and Murray Ross, whose thought leadership created the agenda that we have today. I also want to thank Diane Ford and Ella and Christina Hugh, who are behind all the scenes that happen here today and make everything happen hopefully seamless for us today. So if everything's going right, please give Diane, Ella, and Christina a thank you. We're excited about today's agenda. We're going to have multiple perspectives, as the Dean spoke about, on policy and operational shaping, operations that are shaping the healthcare delivery. I'm also glad that we will end this day with a reception. And a lot of you are thinking, receptions are great. And I want to tell you another reason they're great. Not only is there a bar, but there's an opportunity to have some more fellowship with each other and to meet some of our students. Our students would benefit a lot from insights that you have. They're looking for ways to think about this profession that they've chosen, and we would love to have you engage with them. While the conference is our flagship convening, the center's work is also about putting cutting-edge research to action. So we fund a lot of research from our faculty and our graduate students, and thank you to Alethea Caldwell for her funding that makes that happen. We also value global collaboration, so thank you to the K Foundation for supporting partnerships between UCI and Taipei Medical University. And we contribute to educational programming and student experiences across the Mirage School and the campus for healthcare. So thank you to Dr. Rika Fable for helping us with that. We're looking forward to the first healthcare case competition this year, and that will open on April 20th, and the finalists will be presenting to our center board on May 5th. So thank you for being here and for leaning into the conversations today. I encourage all of you to read through the impressive bios of our speakers. And it is now my pleasure to introduce Dr. Steve Goldstein, Distinguished Professor of Pediatrics, Physiology and Biophysics, and Pharmaceutical Sciences, and our Vice Chancellor for Health Affairs.
Good morning. I will welcome you as well. In 2024, U.S. healthcare spending exceeded $5.3 trillion. Almost $1 in every 5 that we spent. And yet, access, affordability, workforce strain, public trust remain defining challenges. And that's even as we are now negotiating federal policy shifts, market uncertainty, Medicare Advantage upheaval, Medicaid reform, and rapid deployment of AI in operations and in healthcare. So healthcare is not just evolving. It's being stress tested. And that what makes today's theme perfect for the time. Healthcare at a crossroads. Looking at the room, I am delighted at the expertise here so that we can begin to talk about these issues that we've been talking about since 1990. But they've become both more challenging and more resolvable because of the tools we have and what we've learned. We will talk about federal research, Medicare, Medi-Cal, administrative efficiencies and inefficiencies, and these are not theoretical. These affect our patients, these affect the providers, the insurers, our health systems. They gave me slides, so maybe we can go to the next slide if that's, or not. So I can't welcome you to UCI without reminding you that we are now 60 years old. And that's 6 decades of advancing an academic health system model. We're a top 10 public university, one of only 71 universities in the prestigious AAU. But at its core, what we are in health is that we follow a mission of discover, teach, heal, which is a powerful cycle of continuous quality improvement. In periods of uncertainty, academic health systems roles become stronger and more important. We're not only providers, but workforce engines, research accelerators, and safety net providers. So across UCI Health and our schools of medicine, nursing, pharmacy, and public health, we train more than 1,000 healthcare professionals every year, directly contributing to the workforce. And for many of us, it's with great pride that our students, over almost 50% of them are first generation to go to college. The recent expansion of UCI Health by more than 1,000 beds and 4,000 coworkers also demonstrates our commitment to access. Last slide. And of course, in the past year, we opened up a new hospital in Irvine, the nation's first all-electric acute care facility, expanding our footprint so that with the community network, we can really serve more than 5.6 million residents in Orange County and beyond. But growth is not the measure of success. Impact is. And the challenges ahead will not be solved by any one institution or sector. They demand coordinated thinking, and we want to be part of the discussion here. We want to bring data, partnership, and accountability. We are here with you so that we can shape the future. So I want to thank you for coming to be part of this conversation, and I look forward to both a productive day and I hope a candid day so we can learn from each other. Thank you for coming today.